hi everybody. My name is Dr. Emma Sloan. I've been in aesthetics for 8 years now, and I own the Sloan Clinics down in Brighton. My background is general practice, and today's talk is going to be about the challenging client, and I'm sure you've all come across in your time the challenging patient. So what I'm going to start with is just summarising the key points really. So always try and use the medical model of care when dealing with challenging clients. Turning clients away doesn't necessarily mean ending the relationship. Sometimes it can take you on a surprising journey. The other sort of message I want to get across is about collaboration with other stakeholders in the community, which is what we do all the time as healthcare professionals. So when we're not sure what to do or where to go with our client, we ask for help. Okay, so it doesn't happen very often, but from time to time, you will have to turn that client away, okay, and turn them down for treatment. However, like I say, it doesn't always mean the end of the relationship. It can be really uncomfortable turning a client down for treatment. And even the most experienced people out there can find this a real challenge. Hopefully, I'm going to give you a few hints and tips on how to manage the challenging client. Okay, so if you can get comfortable with this, I can assure you, you will sleep better at night and you will enjoy your aesthetics career so much more. And what I also think that as part of good medical practice, us as professionals always need to be recognising our limitations. Okay, this is what sets us apart from non-professionals. And the other thing is making sure, that also we are meeting that cornerstone of good medical practice by employing help of others and onward referrals. So I would like to present a few real cases that have come in and out of my clinics over the years, which I think could help you manage challenging clients yourself. Sometimes we turn people away and it's really obvious who it is that we should turn away. They might be breastfeeding, pregnant, underage, and we're all very adept at turning these clients down for treatment. It's the grey areas that can sometimes be difficult. So this lady in the visual that you can see, the one on the top right, she is a 74-year-old client of mine, and she came in. She had a very sagging face. She came in with high hopes and dreams that I could literally pin her face back several centimetres towards her ears. Now, we've all probably had one of these clients in our clinic. You have to take a deep breath because you know that all the tools in your tool cupboard are not going to be able to literally pin back. This lady, when I see these older ladies in clinic, and men, they've come in, they've done their research, they've been to your website, they've seen your fantastic before and after photos. They have pinned their hopes and dreams that you can do this work for them. They'd say to me, I feel 30, and when I look in the mirror, an old lady is staring back at me. So it's really important that we manage their expectations really gently and let them down gently, but leave them with some hope too. So with this lady, I referred her on to a plastic surgeon. When I make a referral, I always refer to somebody who I know, like, and trust, so that my clients are always taken care of. So she went along for her plastic surgery consultation. I made the referral. I made sure that I copied her in so that she could also read about and all my points be reinforced in the letter. I talked in the letter about how her aging process was far beyond the tools in my tool cupboard, but I was hoping that the plastic surgeon would be able to help her lift. So inviting her back afterwards was also really key, and seeing her after her plastic surgeon consultation. And she had decided that the risks and the benefits of having plastic surgery were beyond really what she wanted to do. So she decided to come back to me and have some rejuvenation in my clinic. And she comes back every sort of 3 or 4 months for treatment, and we've gone on a very long journey together. So this is a nice example of how you turn somebody away, but they become your lifelong client. The main sort of like summary points here are: explain how the aging process has affected their face, and then try and explain that the tools in your cupboard won't really do to reverse all of those processes. Signpost and a gentle turn away to a plastic surgeon, and collaboration really is so key in giving that gold standard care to your tribe. The next challenging case is the overfilled client, and you can see this as on the bottom left of the visual. Nowadays, we're seeing so much more of the overfilled client, and we all know that the worst thing we can do is put in more filler. But what they are thinking is that they need more filler. So again, you're sort of managing this mismatch of expectations and what you're willing to do. This is a 32-year-old lady. She came in to see me with these huge lips. She had told me that she had been back to her practitioner with an unsatisfactory result, and the practitioner had put in more filler. The practitioner had also said dissolving wasn't an option, she couldn't prescribe, and she didn't have the skill set to do so. She also added how painful dissolving filler was and how saggy this lady's lips would become. And this woman was terrified, actually. So she carried on going back to this clinic in my local town and getting more and more filler put in. She had 3 meals and a succession of vigorous massages, which only served to push that filler back into this lady's perioral area. This lady, my client, she was on public transport being bullied. People were poking fun at her mouth area. She was turning up at the school gates, people were making references to her, fish lips and things like that. She then got pregnant and had a baby, and this is really where my heart went out to her. She told me that for the first year of that child's life, she did not appear in a single photo with her. And I just really felt for this lady. So what I did with her is I employed a medical model. Again, going back to one of my key points. When managing the challenging client, use a medical model. This medical model is used in GP practice all the time. It's called ICE, I-C-E, Ideas, Concerns, and Expectations. So this lady's idea was that she needed more filler to sort out her lips. Her concern was that she didn't want to have dissolving because it would really hurt and it would leave her with saggy, baggy lips. Her expectation was she didn't want to pay any more money than she had to. She didn't want to have it dissolved and then refilled. It was going to cost too much. It was going to be too, traumatic. So using her ideas, concerns, and expectations, I then formulated a management plan with her. I was able to tell her that there was no way we were going to be putting any more filler in those lips. Secondly, I was able to tell her that dissolving filler was no more painful than having lip filler put in the first place. And thirdly, if done in stages, using a microcannula, we were going to be able to avoid any sagging or baggy lips. We could do it in sort of 2 or 3 stages, which we did. And she had the most fantastic result, and she didn't have to have any more filler put in. So it achieved my goal and hers all in one. And there's some more key points really here that I wanted to highlight is really, we have a big responsibility to making sure that our work is of good quality. We don't want people's lives ruined and people not to be able to have photos taken of themselves with their babies. What we do is actually very profound. We put things into people's faces and we can make them look disfigured, potentially, which, we have to think about. The other thing I think with this case that it highlights is if you can't dissolve filler or you can't correct procedures, really you need to learn how to, or you need to lift the phone to somebody that you know, like and trust, who will help you out here. It's our duty of care as medical professionals, when things go wrong, to be able to right them. And this, again, is a cornerstone of good medical practice. Okay, so the next case is about skin disease. Skin disease, a lot of our clinics, we provide cosmeceuticals. This lady in the bottom right picture, she is also a client of mine who was seen by a skin practitioner for acne. Now, she was put on some cosmeceuticals and was reviewed by me in my clinic a few weeks later. Her acne was prolific. If you look in the picture, she has hyperpigmentation as a result of her acne and scarring. She has a skin disease, which really in an aesthetics clinic, and even as a GP, I would refer. This is beyond my skill set. So again, using the medical model, making sure I practice safely, I wrote a referral to a dermatologist who I know, like, and trust, and who is a really fantastic member of our community. She saw this client and put her on a high dose of tablet medication. As a result, this lady had a fantastic resolution of her underlying prolific disease and then was able to come back into the clinic and start maintaining her skin with our cosmeceuticals. As a result, I formed a really good reputation in the community with a few of the other stakeholders, plastic surgeons, dermatologists, mental health specialists. And what happens is quite often they back refer to me. So this dermatologist often refers people to me with dry skin or fine lines, and I can help them. The main point is, in an aesthetics clinic, we mustn't really be trying to treat conditions that need a medical management because we're delaying them getting that treatment that they really need. Okay, so the emotionally unstable client. So this is a huge, massive, wide area. Unfortunately, aesthetics does attract sometimes can attract the emotionally unstable client. We see a lot of cases of body dysmorphic disorder. And we can screen them using several screening tools like BABS tools and things like that. What can be harder and more challenging actually is the client who has got an emotional disorder or anxiety disorder, depression, something like that. That can be a bit grey. What do we do with those clients? Okay, so again, it's all about using our medical models. You have to be really kind and sensitive with people with emotional instability. They often have received quite a lot, had a difficult life in one way or another, and they are dealing with trauma. They're very vulnerable, and whatever you say to them, they will really hang on to and see negatively. Be careful what you say, and if you turn them down for treatment, it may well feed into their insecurity, make things worse. The over-anxious client, we know about these clients because they cannot decide whether they want treatment or not. They demand reassurance. They want to know that what you're going to do is going to work, that there are no risks. They over-worry. They worry about every little detail. With this client, what I tend to do is I suggest a cooling off period. And I'm very honest with them. And I'll say something like, you don't seem like you've really decided what you want today. And I feel that perhaps today isn't a good day for you to make that decision. You need more time to really weigh it up because I want you to be confident. Because if you're not confident about having this treatment, I really worry that you won't like it. The depressed client comes in and they're really unhappy in their lives. They're suffering with anhedonia. Nothing brings them joy. They come in and they want their treatment. Again, I wouldn't turn a client down for treatment because of depression, but I would say to them, having a treatment won't have an impact on your overall happiness. It might make you feel better about your appearance, but you need to seek some help, okay? So what we have in the clinic is we have two fantastic psychotherapists. With BDD and with some of the other sort of emotionally unstable patients, I will recommend that they see one of our two psychotherapists. Now, not everybody will have a psychotherapist or feel compelled to employ one. But what I would urge you to do is find out who in your local area will provide really good mental health support to your clients. Talk to them about your treatment, get them to know you and what you're about and how professional you are. And then when you've referred them, they can always refer those clients back to you when they're ready for treatment. Okay, so really the last slide is a summary slide about some of the cases that I've chosen to highlight with some key points, tips and advice. And I think that maybe this could be helpful because certainly starting out in aesthetics, I had no idea really where to signpost people to. And I sort of fumbled around and stumbled around with challenging clients. I think the key points here are make sure you always follow that medical model. Always be kind and gentle and sensitive, and also have some phone numbers of some really good people that you can trust, know and like, that you can refer your clients to. Okay, I'm really happy to have spoken here this evening. Thank you for anyone that voted, and thank you to the Spark team for organising this fantastic event. If you want to get hold of me, I'm on Instagram and I have a website inquiry page. If you need to get hold of me, you can. Thank you very much. Enjoy the rest of your evening.
Thank you.
Thanks, Emma.
Thanks.
Come join us. Yeah, that was fantastic. That was a really interesting talk. I love the way you gave your personal examples and experiences that you've had with those different types of clients. So thanks ever so much for sharing with us today. So as a professional, one of the questions is, when do you decide to end the sort of patient-practitioner relationship?
Okay, in the very rare event that you have to end that relationship, I guess the main reasons would be that you feel that maybe you're being a bit manipulated by the client. Maybe that you feel just in your heart of hearts you shouldn't treat them, you don't feel comfortable to treat them, you should sort of turn them away. Or if they're forming a sort of personal attachment to you. These are the kind of red flags, I feel, for ending the relationship with the client. However, if you can refer on, like I was saying, then hopefully a nice balance can be struck and they can get the help for whatever it is that they need. One example was I had a gentleman who was buying filler off the internet and injecting his own face and would come in and ask for corrective work. And I had to end that relationship because obviously what he was doing was dangerous, and by me correcting it was enabling him to carry on doing it. So it's things like that where you just know that in your heart of hearts that you cannot continue that relationship because it's not going to be a healthy way forward into the future for either of you.
Thank you. Thank you very much. And I think, as Sharon said, it's really useful to hear from your experience and share that knowledge with everyone else, and those key examples of what you've been through as well. And I think you've actually answered this question a little bit already, but this was a good question as well. How do you professionally go about ending that relationship with as little as fallout as possible? But 3 main tips really to say no, and if you could give our viewers any advice on that.
I just think as long as it always comes from a place of kindness, you can really be quite decisive and definitive. And I think if you're very honest and you communicate well and you give your very clear-cut reasons why, and you refer on, always give them a bit of hope or another option or somewhere else to go, signpost them. I think really that's the only advice I can really give you.
Thank you.
It's perfect. Yeah, thank you very much, Emma.